So that alone is an encouragement.
That is exceptionally encouraging, I think, right? That we're getting the way you're describing it is it's so ubiquitous, and that fist that happens is so hard to overcome.
Yes.
And the fact that you're 4 years, actually, it's 2021. He's like, I have to get with the times here, guys. 5 years after your stroke. So I think it's really encouraging that that's happening for you.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
So, patients, welcome to Rehab Our Assessments. Remind me of where you're calling from.
I live in Houston, Texas, but I am from West Africa, Sierra Leone.
Okay, very good. And what can I do to be helpful for you today?
First of all, I want to know if I'm doing my therapy right.
Okay.
That's the first thing, yes.
Okay, good.
But yeah, I just wanted to know that when you pull up the chart, the chart is gonna read some weird results, because initially when I started, I wasn't sure of how the machine works. So the first 2 days, I was helping myself using the right hand to help the left hand to move. But then
Okay.
the third day, I found out that the machine does it by itself. All I need to do is to help try to help doing it while the machine is working it up. Or when I'm doing my exercises, I need to try, when the machine is going up, I need to try putting my fingers up. So I've gotten the flexion part a little bit, but
Good.
I'm still struggling with the extension.
Well, patience. First of all, let me commend you for your honesty. I think that is no, it's good, right? For me, there's no judgment here, right? That my main goal is to be helpful for you guys and to help you get as much out of your rehab as possible. So I think it's great that you recognize that that was not the ideal way to do it. And I would very much agree that we do not want to have our less affected, our stronger side help our side that needs the rehab.
Yes.
But that may make it look good on the data, but that unfortunately means that we're kind of cheating ourselves, and we don't want to do that.
Right. Right.
So the way you summarize the approach of allowing the Motus Hand to help you, but it's help, right? It's there to kind of provide the backup for you when you need it. But the fact that you recognize that it's what you have to do, it's your brain trying to help control and relearn how to use your hand again, and the Motus Hand is simply there to help provide some backup when you need it. So I think you very much understand exactly what you have to do. So I'm very encouraged that you're doing it right now. But that being said, let's go through and just check. So do you have any specific questions about the parts of the rehab? Do you have a question about like the donning, how to put it on, or is it mostly about the movements?
No, I got it now. I got it. And so far, to be honest, I am happy because I'm positive. If I keep doing it, I'm trusting my instinct that something positive will happen, because my fingers, I've had my stroke since 2016, and I've been going for therapy back and forth, but my fingers are always in a fist mode. But for the past 2 weeks that I've started using the Motus Hand, I can feel my fingers are loose now a little bit. They are not always clenched together like it used to be. So that alone is an encouragement.
That is exceptionally encouraging, I think, right? That we're getting, the way you're describing it is it's so ubiquitous, and that fist that happens is so hard to overcome. And the fact that you're 4 years, actually, it's 2021. He's like, I have to get with the times here, guys. 5 years after your stroke. So I think it's really encouraging that that's happening for you. And I think that positive mindset, staying engaged, is one of the most important elements. So I'm going to be your cheerleader then, if that's what you need to have.
Yes.
But in terms of, so it sounds like you're already on a great path. What we can do though, is let's just look at the data and see how things are going. And
Okay.
with that and being said, let me look at where we are right now.
All right.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
Let's see here. And remind me, how long have you been using? Like just a couple weeks now, right?
Yes, 2 weeks to be
2
exact.
weeks. Okay. Okay. And while we kind of think through this, are there any things that I can help adjust for you? Any of the activities you're not so fond of, or ones you really like, we can incorporate some more time?
Yeah, I love the Candy Crush type.
Okay, good.
And the one that you do the lifting up and down.
With our strongman.
Yes, yes.
Okay. I think it really we need to make it a strong person, I think, or it doesn't need to be just a strong man, but yeah, I think the strongman exercise is really good because it's so visual, right? We know what that's like, being able to lift up and down. So that's really good. Are there any activities that are not good for you, you don't like connect with, or are there any activities that do not make sense so far? Something we could help kind of go through.
Yes, like the fishing. I still don't understand how it works. Sure. The fishing thing, yes.
Okay. Well, patients, what we could do, or do you have your Motus Hand ready to go right now?
Yes, I'm hooked to it.
Okay, let's just take a look here. Let's see. Now, what we could do, patients, I can actually explain that game really quickly to you. If you want, you can go ahead and begin therapy. And we can, let me go, before you do that, actually, let me go ahead and move the fishing game up. I'll try to move it up as far as I can here on your exercises. Okay, so give it just a second here, patients. Okay. What I did is moved it up, that we don't have to skip down to it. But I want to go through it with you so that it makes sense. It actually is. It's one of the more complex exercises, so don't worry that it's not so intuitive. It is a little bit strange. Okay. So let's see here. Okay, on your side, go ahead and hit begin therapy for me, patients.
Okay. Start from assessment. Which one?
No, I'm gonna have you hit the back button for me on the top left.
Okay. Okay. Then assessment, right?
No, I'm gonna have you hit home for me.
Home. Yeah, I'm home.
Perfect. And then begin therapy. Yes, ma'am. Let me know when that starts up for you.
Okay.
Okay.
Okay, it's on now.
Perfect. Is fishing up and running?
Say that again.
Which activity is there?
Oh, I think it's the assessment.
Okay, go ahead.
Yes.
Go ahead and skip that.
Oh no, it's the fishing.
Oh, great. Okay, so let's go ahead and do it then, patients. So let's go ahead and do it. So fishing is interesting. So the whole idea here is there's a little bar, a little green bar that's there. You are the green bar. So your position in space maps onto that. Okay. And the idea is to keep the fish inside of that green bar.
Okay.
And patients, have you ever been fishing before?
Yes.
Okay. So whenever you fish, you have to keep a certain amount of tension whenever you catch a fish. If you pull too hard, it will break the line. Or if you let it go too loose, the fish will swim away. That green bar is to try to keep the fish. It's like the tension. We have to keep the appropriate amount of tension on the line. So what your idea there is to try to keep that fish inside of the green bar.
Okay.
And as you do that, the more time you keep the fish inside of that green bar, you'll notice that the blue bar to the right of it fills up.
Yes.
And as soon as you fill that blue bar up, it's like you rolling in the fish or reeling in the fish, and you'll catch it.
Okay.
So it's quite challenging because the fish moves around randomly, and that means that you have to move and dynamically control things. So it can be quite a challenging exercise.
It is.
Yeah. But did that help to kind of clarify things a little bit for you?
Yes.
Perfect. And patients, do you have any other questions for me or anything else I can be helpful for today?
Yes, I do. What I want to know is when the hand device goes up and when the sign comes to bring the hand down,
Yes.
do you have to do it yourself? I noticed that when you start doing it, then the machine will kind of help. Is that how it's supposed to be? Because
Yes,
sometimes
ma'am.
it's tough when you want to bring it down, it's still hard.
Yes, it is. So this is where we can actually use the muscle inside to help you lower down. So it is going to be hard because if we have to put assistance in to help you move up into extension, it takes some time to take away that assistance to help you move down. And so you're exactly right. That sensation is normal to feel, that difficulty to move down. So that's totally fine. I just encourage you to try your best to move down. And what will happen is the Motus Hand will detect that and provide some assistance into you moving down.
Yes. Sure I was doing it right.
You are doing it right. Provided that your stronger hand is not there kind of pushing down or pushing up, I think you're good to go.
No, I don't do that anymore. As soon as I realized I wasn't doing it right, do something that the machine wants me to do that will register to the brain.
Yep.
So I don't need to help with my good hand. If I do that, I'm deceiving myself.
Yes. Actually, patients, what I can encourage you to do is you can use your other hand, your stronger hand, but don't use it to help. You can use it as a model to go up and down, to mirror. So I would encourage you to do that as well.
Okay.
Okay. So patients, any other questions for me?
Oh, no, not really.
Okay. Well, don't worry. If you have other questions, just reach out to us. And this is not the last time that we'll work together. So you just, we'll put you on the schedule for a week or so and we will touch base then. Okay. And if you have any questions between now and then, don't worry, just reach out and we'll be, our team is here to support you.
Okay. I think I want to ask you, what can we do to help improve the extension? I'm having difficulty with the extension. The flexion, it's very hard, but I'm getting it. At least I'm able to do it.
Yes, that trick that I just showed you of using your stronger side to mirror is one really nice way to try to get our brains to turn on as those extensor muscles again. So I would encourage you to try that. So for instance, when the fishing exercise, when the fish moves up and that with your stronger side, go up and the Motus Hand's going to go up with it. Okay. Yeah. So kind of really mirror that. And what that's doing is that's using both sides of our brain to kind of follow the task. And that's kind of going to increase the probability of us actually doing the right activation of our brains.
Okay.
Okay. I know it's tough, patients, but you're doing a good job. Okay.
Yeah, thank you.
Okay. Well, I look forward to working with you very soon. And like I said, if you have any questions between now and when we are formally next scheduled to talk, like I said, just reach out to us and we're here to help. Okay.
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 Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.